Is death silently creeping up your legs right now? That might sound dramatic, but here's the shocking truth. The earliest signs of deadly heart attacks, strokes, and blood clots often appear in your legs years before the final crisis. And by the time most seniors finally notice these symptoms, they have less than 5 years to live. Doctors don't always mention them, not because they want to hide the truth, but because these signs often look harmless at first. A little swelling here, a slight discoloration there, or a nagging cramp when you walk. Most people dismiss them as just getting old, but ignoring these hidden warnings can cost you decades of healthy life. Today, I'm going to reveal the 3 deadly leg symptoms that silently predict early death after 65, and more importantly, the simple science-backed protocols you can use to reverse them, protect your circulation, and add 10, 15, even 20 extra years of vibrant living. This video could literally save your life, or the life of someone you love. So watch until the end, because every second matters. But before we dive in, make sure you hit the like button. It tells YouTube this message is important, so it reaches more people who need it. And don't forget to subscribe so you never miss vital health insights that most doctors never tell their patients. All right, let's begin. Howard's wake-up call. Howard was 67, a retired engineer who loved his morning walks and weekend gardening. He prided himself on staying active. But little by little, his ankles began swelling by the evening. He brushed it off as normal aging. Soon, climbing stairs gave him painful leg cramps. Again, he ignored it. His doctor never mentioned these symptoms at annual checkups. Nobody warned him. 6 months later, while visiting his grandchildren, Howard suddenly collapsed in a driveway. A massive blood clot had traveled from his leg to his lungs, pulmonary embolism. He nearly died on the spot. The ER doctor told him something chilling. The warning signs were in your legs for months. If someone had recognized them, this never would have happened. Howard spent 3 weeks in the hospital and thousands of dollars in medical bills, all because no one taught him what I'm about to share with you. So let's uncover these 3 deadly leg warnings, starting with the most common one. Warning sign number 1, persistent leg swelling. Do your shoes feel tighter by evening? Do your ankles or calves look puffy, even after a good night's sleep? If swelling lingers into the morning, your body may already be sounding an alarm. Vascular specialists at Johns Hopkins warn, persistent leg swelling often signals that your heart isn't pumping blood effectively. This condition, called venous insufficiency, increases your risk of fatal cardiac events by 84% within just 5 years. A 10-year study in the American Heart Journal found that seniors with chronic swelling had a 57% higher risk of death from all causes compared to those without swelling. Yet most doctors don't mention it until it's dangerously advanced. Case study, Nancy's story. Nancy, age 73, noticed her ankles stayed swollen after her weekly card game. She thought, I probably just sat too long. She bought wider shoes. She ignored it. 3 months later, she was rushed to the ER, gasping for air. Her heart was functioning at just 35%. Her swelling had been the first silent sign of congestive heart failure. Average life expectancy after diagnosis? Just 5 years. Nancy later said, if only someone had told me what that swelling meant. The solution, the 30 to 33 protocol. Here's what specialists recommend but rarely tell patients. I call it the 30 to 33 protocol. 130 minutes elevated legs daily. Lie on your back with your legs raised above heart level. Use 3 pillows under your calves. Do it after lunch when fluid buildup begins. Improves vein function by up to 30% in 1 week. 2. Eliminate 3 sodium bombs immediately. Canned soups, processed deli meats, antacids. Yes, some are loaded with salt. Cutting just these 3 reduces swelling by up to 40% in 72 hours. 3. The 30-second sock test. Press your thumb into your ankle for 3 seconds. If the dent stays longer than 5 seconds, call your doctor. Ask for a BNP blood test. It detects heart failure years earlier than standard exams. Are you already doing these 3 steps? Or are you gambling with your life, like Nancy? Don't wait for the ER. Protect your heart now. If this tip shocked you, hit the like button so YouTube shows this to more seniors who need to hear it. Warning sign number 2, discoloration and temperature changes. Have you noticed patches on your legs turning pale, bluish, or reddish? Or maybe one area feels colder than the rest? These are not cosmetic issues. They are silent vascular emergencies. Mayo Clinic researchers warn color and temperature changes often signal peripheral artery disease, PAD. PAD increases your risk of stroke and heart attack by a staggering 400% within 5 years. Even worse, a study in the Journal of Vascular Surgery found 76% of seniors with these symptoms died within 8 years if untreated. The case study, Gerald's story. At 69, Gerald noticed a small pale patch on his calf. His doctor said, "Don't worry, it's just poor circulation." Months later, the patch grew. Walking became painful. By the time he got a second opinion, surgeons discovered 3 massive blockages in his leg arteries, days away from forcing amputation. The specialist said, "The warning signs were on your skin for months." The solution, a 3-step circulation boost. 1 pulse check at home. Feel the top of your foot and behind your ankle. Both pulses should be strong. If weak or missing, call your doctor immediately. 2-3 daily circulation exercises. 30 ankle rotations in each direction. 50 toe curls/extensions. 20 seated leg extensions. Do them 3x daily. Studies show circulation improves 35% in just 2 weeks. 3 circulation superfoods. Fresh blueberries. Salmon or fatty fish. Dark leafy greens. A 12-year study in circulation found seniors who ate these 4x a week had 67% fewer arterial blockages. Would you rather spend 10 minutes a day doing these steps or risk losing your legs and your life? Comment below. Have you ever noticed discoloration or cool patches in your legs? Sharing might save someone else's life. Warning sign number 3, leg cramps and pain when walking. Do you ever need to stop and rest when walking because of leg pain? And once you stop, the pain fades, only to return when you start again. That pain is not just age. It's your body screaming for oxygen. The American Heart Association confirms this pain pattern, called claudication, triples your risk of fatal stroke within 4 years. The New England Journal of Medicine reports seniors with this symptom live 10 years less than those without it. Case study, Evelyn's story. Evelyn, a retired teacher, loved walking her dog. Slowly, calf cramps forced her to stop every block. She was embarrassed to tell her doctor. 6 months later, at her granddaughter's birthday, Evelyn suffered a massive stroke. Her neurologist said that leg pain was the first warning your brain arteries were clogging too. The solution, 7-minute stop-start walk. 1 Stanford's walking protocol. Walk until pain starts, even if just 30 seconds. Stop, rest, then walk again. Repeat for 7 minutes daily. This stop-start pattern boosts blood flow by 45% in 6 weeks. 2-3 foods that dissolve plaque. Garlic, 1 fresh clove daily. Pomegranate juice, 4 ounce daily. Walnuts, a handful in the morning. Together, these reduce blockages by 26% in 90 days. 3. Ditch corn oil immediately. Harvard found corn oil accelerates plaque buildup. Replace with extra virgin olive oil. Arterial flexibility improves by 31% in 30 days. Would you trade 7 minutes a day for 10 extra years of life? Evelyn wished she had. If you're still watching, hit subscribe right now because I release life-saving tips like this every week. Finally, now you know the 3 deadly leg symptoms that predict early death after 65. 1. Persistent swelling. 2. Discoloration or temperature changes. 3. Cramping or pain when walking. Each one is your body's way of begging you to act before it's too late. Ignore them, and the cost could be your independence or your life. But the good news, each one also has simple, proven solutions you can start today. Elevating your legs, eating circulation superfoods, walking smarter, and ditching harmful oils may sound small, but they can literally give you decades of extra time with the people you love. So ask yourself, are your legs trying to warn you right now? Don't wait until you're rushed into an emergency room. Protect your future today. If you found this video life-changing, please Hit the like button so YouTube spreads it to more seniors who need it. Subscribe to our channel for more life-saving health and longevity insights. Comment below which symptom shocked you most. Your story could save someone else. And share this video with a parent, grandparent, or friend over 65. It might be the most important gift you ever give them. Remember, your future self will thank you for the choices you make today. Stay strong, stay healthy, and I'll see you in the next video.